Hi, I'm Shelley with Summit Dental Care. Today we're talking about periodontal disease. Periodontal disease is an infection of the bone and the tissues surrounding the teeth. Typically speaking, periodontal disease is going to start as gingivitis, which is redness and soreness of the gums. At that phase, it is reversible and we can stop that disease process. If it is untreated, then it can lead to periodontal disease, which is where that infection actually starts to affect the bone. And once that bone is eaten away, it cannot come back. It will not grow back. And typically a lot of people will notice that those symptoms disappear in that stage. So they'll come in and they say, I don't have bleeding gums, I don't have any soreness, my teeth don't hurt. Symptoms that you may notice if you do have periodontal disease is you may have some bad breath that's happening. Maybe someone in your life is telling you, something just doesn't quite smell right. Something else you may notice is that maybe your teeth don't feel the same as they have before. Maybe that there's some spacing in between your teeth, or that your teeth are actually moving a little bit. That infection is no longer at the surface level and it's actually down deep, and it's starting to cause problems deep under those tissues, removing that bone support and that foundation that supports the teeth in the mouth. If periodontal disease is left untreated, it is chronic, it is progressive, so over time you could notice that you are losing your teeth. So it's really the foundation of your mouth. So perfectly healthy, beautiful, white, wonderful teeth can actually start falling out if you're not doing anything. The other big aspect of periodontal disease is that it really affects your overall health. So it can affect your heart disease, it can affect diabetes, it can affect pregnancy and preterm birth. It affects arthritis. It can make arthritis symptoms worse. So it really exacerbates the overall health of your body if that isn't correct either. If you're not well, it's going to make it worse over time. But the good news is that it is manageable. It's a manageable infection, and that we can maintain the health of your mouth over time. So if you're coming into us, we can address it, say, hey, here's the severity, let's take care of that. And that's something that we as hygienists do every day. And it's our specialty, it's what we live for, it's our favorite thing in the whole wide world. So come in, we do periodontal therapy where we actually address the bone and the tissues and the tissue health. We disinfect everything, we start you back on that right path. Most people are gonna get a great result. Most people are going to be able to maintain their teeth for a lifetime. Even cases that I thought were maybe not so hopeful, we've had wonderful results, and it's been such a good experience for both me and my patients. Prevention is super simple. Prevention is making sure you're doing that regular maintenance that we've been taught our whole life. Making sure that you're brushing your teeth twice a day, that you're flossing every day, that you're getting access in between the teeth, taking the recommendations of your dentist and your hygienist, whether that's using a water pick or interdental brushes. If you're noticing bleeding, now's the time to take care of it because it is reversible when you're having that early gingivitis stage. Teach your kids, making sure your kids know how important it is to brush twice a day, floss every day, using those different home care remedies that we all know we need to do, but maybe we sometimes forget. And it's not hopeless. If you have bleeding, definitely come in. Let's get it taken care of. I'm Shelley with Summit Dental. If you have any questions or concerns, please call or come into the office. We'd love to see you. Thanks for watching.